But before we move on to this topic, I'd like to kind of end on an up note, as far as as far as your role, in getting grandma into the right and appropriate setting. Kind of maybe share with us a little bit, mm, nothing really specific, but I mean, how it is to help these families,
Mhm.
and what you get from that. Because I mean, everybody has good days and bad days and things, but share with us, when something where you're like, hey, I really did something, or this family really, they have the right information, and they really made the right decision, and I think this patient or this person's going to be okay.
Yeah. Well, I mean, and to be clear, I chose to move into this area of psych because I went up to cover 1 week, and we had been covering the unit for several months without a full-time social worker up there, and I loved it. So I don't mean to give the impression that it's all difficult and everything, because the bottom line is the elderly are often adorable. Even in their demented state, and even when they're raising hell, they're funny. They've got a lot of wisdom, even when they've lost a lot of their other faculties. They're just a lot of fun. They're really adorable. And yes, I have to do a lot of explaining to families, but I would say a lot of the time, and I don't want to say that it's more so on geriatric psych, but I get to experience it more on geriatric psych than adult psych. The families are starved for the information, and getting the information is something they're just incredibly grateful for a lot of the time. It may take a lot more time to make them understand, and it may take a lot of reframing the situation for them, and it may take a lot of long conversations about realistic expectations and what's going to happen down the line, and preparing them, the family preparing themselves for what comes next, or processing what's already happened. But I have to say, a lot of the families they're starved for that information and for someone to guide them in that way. And so there's a lot of gratitude. I get to work with families who need the information, want the information, and then when that information helps them put their elderly loved one in the right place, it's a really good feeling. And often families will call me back and say, "Wow, Grandma did really great in this nursing home. She just settled right in. She's made a little friend. Her and her roommate are already talking about going on outings together, and blah blah blah." And or someone who had been throwing punches at an assisted living, put them in a more structured dementia unit in a skilled nursing facility. Wow, Grandpa hasn't thrown a fit in 2 weeks. He hasn't gone. He hasn't punched a nurse in a while. He has, they just they're handling things differently, and he's doing really well. And the structure's been great. So there's a lot of advantages to doing it. And plus, I mean, it's just it's so much fun working with those people. Some of it's sad and some of it's hard, but sometimes older people are just hilarious too.
And it's definitely a thankless job, and it is the work that you guys do is just it's just incredible. I don't even know how you keep all that information straight, because I know that I rely on my case managers, social workers, just to kind of explain to me, hey, what does this mean, or what does that mean, or what if we do this, or what if we go in that direction. It definitely helps me try to figure out how I'm going to advise families and patients on what to do next. Because I know what to do from a treatment standpoint, but as far as from a setting, um, where they're supposed to be, what the appropriate facility is, what kind of facility it is. Definitely, you guys do great work,
Yeah.
and it's definitely a whole team concept to take care of people. And I really didn't appreciate that until I started working in an inpatient setting and saying, hey, this is what I need to know for this and that, and you guys definitely helped me with that.
Yeah, and I think doctors being receptive to that, and I'm really lucky to work with a really great geriatric psychiatrist, and several of them. But um, the unit's great. It's built in a very team-centered fashion, and it's really great to work with doctors who want that information and use that information. You know, when I say, hey, today might not be a good day for discharge because the family doesn't have the bed in the house yet and they don't have the, you know, like we may need to hold off, or, you know, it's just good to have all this information and to be part of that team. I definitely work in an environment where I'm part of that decision-making process and I'm part of the team and we're helping the family together. And that's really cool.
Well, cool. Yeah, I mean, it's been great talking to you about this. I know you and I have been trying to come up with the best time to talk about this patient related stuff, and it's been very cool. It's great, but I think now it's time to get a little bit geeky. What do you think?
I will always talk about geeky things.
All right, we'll take a little bit of a break. Our guest is Brandis. You can find her at brandis.net. I'll take a little bit of a break. After the break, that's right, Brandis and the iPad. I know people are on the edge of their seats wanting to listen to this. So we'll be right back here on the Dr. Anonymous Show. Don't go anywhere.